Good afternoon, everybody. We just wanted to welcome you. We're very excited to spend this time with you to talk about eating disorder versus food addiction, our webinar today. And, I know people are just sort of coming on. And so I am first going to turn it over to my colleague Tosca, and we are going to go through some things. We're going to do our introductions first, and then we're going to go through a case study of eating disorder versus food addiction. And in that, we're also going to talk about the symptoms of addiction for food and the disease concept of addiction for food, as well as treatment options. And then we left time, certainly at the end, for questions and discussion. We really want to hear what your thoughts are and, any issues or questions that you want to discuss further.
Yeah, hello everyone. My name is Tosca Lindberg, and I am a coach with Shift. I've been with Shift for a couple of years now, and I'm really grateful to be with you guys today. We've done a number of webinars, but this one is going to be exciting, brand new, and we get to hear in detail a lot of Christine's experience that might be different than anything we've put out before. So I'm excited about that. Well, my story is I'm just hitting 5 years of abstinence from flour, sugar, and quantities. And here are some of my pictures that I'll just run through my story really briefly. You could see me as a kid. I was not a heavy kid, but and I'm quite tall, so there's the basketball stuff there. Oh, Christine's going too fast. There we go. That's all right. So I was not heavy as a child, and yet I had all the experience of being addicted to food from a young age. I can go all the way back as far as I can remember. I kind of imagine that I was born with a food addiction because my youngest memories, I have several that are surrounding, I just started noticing like other people aren't like me when it comes to candy and sugary things, and food in general. And I could not actually, I started just thinking, oh, what's wrong with me? And so, that picture of me with the basketball, it was my freshman year in high school. And I just remember at that, like I was so self-conscious when that picture was being taken. I could have died. I just was so self-conscious. And I thought I actually probably had some body dysmorphia because I thought I was huge. And obviously I wasn't looking at my pictures. I was nice and thin. Playing in college, I started calling myself a sugaraholic. And I used to laugh it off that like this was how I coped with it. It was like, oh, I'm getting away with it, because I wasn't heavy, and like, they ought to just have like a 12-step program for sugaraholics. I said I really could compare myself to an alcoholic at that stage. And I stole food. Yeah, like I binged. The weight didn't catch up with me. Although you can see further down, the weight did eventually catch up with me. My high weight was 273-ish. And yeah, when I came into program, I lost 80 pounds. I wasn't at my high right then, so I came in at 243, and I lost 80 pounds in program so easily and so peacefully. Coming into a 12-step food addiction program, I gave up flour, sugar, and quantities, and I could not believe how my life was transformed, not just from putting the food down, but putting the food down was the first step. But for me personally, it's nice to like be skinny and have that weight off, but the weight that was more important that I got off was like the self-hatred and the shame and I used to just beat myself up in my mind constantly. And to have that be dropped, not like I'm not perfect or anything, but so much less than I used to. I mean, it used to just be constant. And so I'm so grateful. Um, and I had a career as a teacher for many, many years, and it became natural for me. That last picture there, you can see me. I'm actually teaching about 12 steps food addiction, and I decided to pursue coaching with food addiction because of the transformation that my life went through. I've just been incredibly grateful. It goes so much deeper than just the physical. They say you come for the vanity, but you stay for the sanity. And that's where it's at right there. So I'm incredibly grateful to be here with you guys. I'll be fielding questions. I'll be monitoring the chat and dropping some links in later. But the bulk of this is going to be Christine's story because she has quite an incredible one. I was so grateful to get to meet Christine like a year and a half ago now. She came into recovery with Shift and we hit it off right away, of course. And she's just got an incredible story to share. So pass it over to you, Christine.
Thanks, Tosca. And every time I hear your story, I just am just so inspired. And I think that the key piece, I mean, for most people losing over 100 pounds, like that's the thing, right? And that's just sort of the side effect or, the secondary. And I love hearing you say that. And I see that true in your life too. So it's really inspiring.
Yeah.
Um, I I can't believe she's letting me drive this slide. So there might be some wonkiness, but my name's Christine Gaggin. I'm a nurse practitioner and I am a food addiction coach at Shift. And you'll hear the story of sort of how I end up here by going through. I'm going to use myself as a case study, to really hopefully that hearing my story, there might be something that you can identify with. But where I've battled this food disease for 30 plus years and really really suffered and struggled and couldn't have tried harder and just couldn't have felt worse about myself. And I've had so much hope and a 180, and I really want to offer that to anybody that is looking for hope. So I was a normal weight as a child. I didn't, I was very active. I think the number one thing that saved me from being overweight is that we just never had it. I didn't have access to it. We didn't have sweets in the house. So candy was definitely my thing. Sugar was my thing. But that wasn't really in our home. I grew up in a loving family. Both of my parents were raised by alcoholics, so there was some addiction tendencies. And my dad definitely used alcohol frequently. I wouldn't qualify him as an alcoholic. That would, be somebody else has to make that decision about themselves. And then my mom definitely struggled with food. She was, on and off a diet for most of my life. But her thing was more like salty, crunchy. So those were the things she had in the house, and she didn't really have in the house the sweet stuff. It was very obvious for me at an early age, like sugar did something for me. And so, my first memory of it was like, I was like 5 or 4. And my mom came in and I was sitting on a chair reaching above the refrigerator where the Flintstone vitamins were kept. And I had downed about half the bottle when she'd gotten there because that was like the most access to sugar that we'd had in our house. So that sort of could have, tipped me off, maybe that there was a problem with sugar. And then, also the one time a year that we really had access to candy was around Halloween. My mom really wants whatever candy we got, she let us be in charge of it. And, my sisters would last for months and mine would be gone in like 2 days. And then I was constantly begging my sisters for their candy or stealing it or, all the things a good little sister does. Um, and then so everything was relatively normal at that point. Just really active in sports and dancing, school. And then like everybody, there's always some situations that happen. And so for me there were several traumas that happened in my teenage years. And so one was a sexual assault, and the other one was a really bad car accident where I went through the windshield. And, so out of that, the sexual assault was something that I kept a secret for multiple years, and then, it was a different time, just so, I'm I'm 50 now. And so, this happened, when I was around 14. And so, it was a different time. I actually didn't have that many physical injuries from the car accident, but I started having terrible panic attacks. And so I think if I had had a lot of physical injuries, it might have been, I had stitches and a concussion and, some minor things, but not what you would expect for that. So there really wasn't identified that, hey, I might need some support. And so, that was a lot, for me to process at the time. And so, what happened after that is, I developed an eating disorder. And so just kind of to review with you guys, what an eating disorder is, it's typically, defined as maladaptive, patterns of behavior. So it's really focused on behavior related to food, in the consumption, the emotional and physical well-being around food. There might also be attempts to offset the consequences of eating too much by abusing laxatives, purging, with vomiting, exercise, bulimia, or exercising to get the food off, or self-imposed starvation. And examples of eating disorders: anorexia, bulimia, binge eating disorder, ARFID, which is a avoidant restrictant, and there are others, but those are the main ones. Um, and the key thing about eating disorders is that the treatment is really focused on the psychological problem, a lot of times with an underlying focus of impulse control or emotional eating. And, not surprising, studies have shown that traumatic events often occur, that can be a precipitating factor for eating disorders. And so, trauma could be a cause. And so that, certainly didn't recognize this at the time, but now as a woman in recovery looking back, it's no surprise that right after all that happened that I had developed an eating disorder. And so the way that it manifested for me in high school was bulimia. And it's, I'm on the left, my poor sister on the right, and you can see I'm such a happy kid, right? I look so happy, typical teenager. But the bulimia, it involves episodes of binge eating followed by behaviors to get rid of it. For me, it was always purging. There was with vomiting, there was a time that I did misuse laxatives, but for the most part, it's been vomiting. It started when I'm 14 and it continued until a year and a half ago when I got treatment. And so a key feature of, bulimia is that weight fluctuations are common, but most people with bulimia have a normal weight. And so they look normal, right? So, for the most part of my life, I've looked normal, but, there's a lot of potential health problems. And during this time, this was all, I had the secret sexual assault, I had the panic attacks that were from this car accident. I think on reflection, one of the reasons I might have started being bulimic is, I had this secret of I had this sexual assault and I didn't want anyone to know. And so then the bulimia became another secret, the secret to kind of mask the original secret. And, I finally, several years later, told my sister, and with her support, I told my parents. And, of course, they were very concerned and, got me into, seeing a eating disorder specialist and a nutritionist that specialized in eating disorders. And then, I think that, oh, that was just my high school graduation picture. So you can just see, normal weight, sort of round, a little bit of cheeks. Of course, I thought I was very fat. And then with my hyper focus from my parents, on it, I think then I went into this brief moment of anorexia where, I just was able to significantly restrict. And this picture here, I had ended up doing inpatient treatment for anorexia. And this picture here is several months after that treatment. And so I had gained weight, in this picture. I was about 10 to 15 pounds above my lowest weight. The BMI scale, which we really don't use anymore, but, less than 18 is considered underweight. And my BMI was about 15.5. So it was in the severe category for anorexia. And that's characterized by severe restriction of food intake, an intense fear of gaining weight, significant weight loss and low body weight, distorted body image, preoccupation with thinness, restricted eating patterns, and certainly potential life-threatening complications. So, I did treatment, and, my parents, again, were really supportive, but really didn't understand. And also, I think I just wasn't ever really honest all at the same time, because I didn't connect the dots of what was really going on. That, when I came out of treatment, when I started gaining weight, like that was an indicator that I was better. And so, but I'd never stopped purging. I just couldn't restrict anymore. And so, that started the continued battle over the years. If you start on the right and then kind of go to the left, just a slow gain of weight over time, right? And so, I really, and I'll show you on a future slide, but, I was trying everything to kind of control it. And it was still a secret. It was always a secret. It was this thing that, my sister knew periodically through the years, and, maybe one or two friends, but it was something I really kept private for the most part, to the best of my ability. And, as with any of this type of disorder, it goes on, if it goes untreated, it just gets progressively worse. And so I didn't understand why that was happening. I didn't understand why what I used to do worked before. And then you can see here, I just continued to gain weight because I wasn't honest about that I was still purging. I was diagnosed with binge eating disorder, which is recurrent episodes of eating large amounts of food within a discrete period of time, eating more rapidly, feeling, eating beyond feeling uncomfortably full, feelings of distress, guilt, disgust after binge eating, and then, just the frequency of it. And so, I'm 5'4", at my highest weight, I was 229, at my lowest weight, I was 95 pounds. Um, and so if we look at this sort of BMI scale again, which is outdated, that's really not how we use to look at weight now, and what's a kind of quote normal weight for somebody. But you can see all these different women, like I was all of them, right? And I was diagnosed with multiple different, I was anorexic, I was bulimic, then I was obese with binge eating disorder. And it was all, the same struggles, it just manifested, it looked different. And man, did I try. I tried. So the things, here's a summary of what I tried, right? I did inpatient eating disorder treatment. I've seen multiple eating disorder therapists, multiple eating disorder nutritionists. I did cognitive behavioral therapy, DBT therapy, internal family systems. I tried medications. I did therapy for trauma. I researched that there was a correlation with women with ADHD and bulimia. I enrolled in a study at Mass General for that. Didn't help. I tried 12-step meetings at the time. That did not help me. I tried numerous diets, which again, as a compulsive eater and bulimic, I really struggled to stick to. Weight Watchers, Jenny Craig, Whole30, vegan, plant-based, raw. And then I also tried some other complementary therapies of mindful eating, intuitive eating. I went down this yoga and eating disorder path, meditation, and then I got sick of, Western medicine, and I started seeing holistic practitioners. I did multiple cleanses. I did acupuncture. I was hypnotized twice. I did past life regression therapy. I saw a shaman for 2 years. I was also a nurse practitioner working in the health field, and like I was helping people in nutrition. I was helping people with substance use disorders, and yet I couldn't help myself. And then I of course read multiple self-help books, most of them to try to help myself. And they were all treatment failures. They didn't work. And I was so discouraged and disgusted, and I didn't know what to do. I felt like I tried everything. Um, and so, I think the key thing that I can look back and see now is that traditional eating disorder therapy assumes the problem is not the food, right? So it really is like not what are you eating, it's what's eating you. And so it's all that emotional stuff. And I worked on all that emotional stuff over the years for sure. And so, so for traditional eating disorders, the problem might not be the food, but then for some clients, some patients like myself, what if food is the problem? And so Phil Wardell, he's been a pioneer in food addiction. He created Acorn, which is now Shift. One of the questions that he recommends asking, like if somebody has done at least a year of therapy on their emotional eating and they're still binging, they're still purging, restricting, they're still hyper focused on weight, food, or body image, that maybe food is the problem, right? Maybe there is a chemical dependency on food, not just the emotional. And so, I think that's a really important thing to look at. So I just want to go over, Phil came up with this criteria of sort of how to think about different types of eaters. And so we use normal, right? We put it in quotes of normal eater. And this is somebody that might just have a weight problem. Like they might be, overweight or obese. They really like food, or, a tangent I can go on, but I won't. But, our processed food industry, that's changed the chemical dependent, the chemical components so much of our food that it makes almost everybody start to be dependent on it. So maybe they're in an environment of they're eating a lot of processed foods, but the problem for a normal eater is really just physical, right? That their solution is they can do a medically approved diet, they can do moderate exercise. This is a patient that might do well with a GLP-1 medication, right? Like, so it's a medication or something that's going to help this physical problem. And that, if you empower somebody with knowledge, then they can, about their diet, about their health, about lifestyle changes, then they can make the change and they can use willpower, and then they solve that problem. And then there's that middle category where a lot of, traditional eating disorders are put, in the treatment, as that the problem is physical and emotional. And so there could be binge eating, restricting, purging over feelings. A lot of times there's that unresolved problem, trauma. Sometimes there's weight, right? Can be overweight, could also be a normal weight or underweight, right? Like restriction. And so the solution for that has been mental and emotional. And that's really developed the skills to cope with feelings, other than the restricting, purging, resolving past traumas. And then the physical, right? Like getting some recommendations from a clinician about a diet, exercising more, and those things, with the moderate eating, with a little bit of support, then and and it could be deep emotional work, right? There could be deep trauma behind it. But if that work is done, then the symptoms improve. And then the third category is the food addiction. And so that's the chemical dependency, where the problem is physical, it's the mental, emotional, and it's spiritual. And by spiritual, I do not mean religious. Somebody explained spirituality to me is what you see when you look in the mirror. And so there are actual physical cravings, there's a chemical dependency on food, and that creates this mental obsession. We're going to go into that in pretty good detail in the next couple slides. There can be trauma, and there's often weight. There's often obesity, but not necessarily, right? So there are food addicts, and I think it's a lot harder when you aren't obese and you're a food addict, because it takes a lot longer for somebody to recognize it, and it's harder to get treatment because you're not as motivated to do the thing because you don't have weight to lose. And so solution for the food addict is the physical, emotional, and spiritual. And so a lot of times it's an abstinence-based treatment plan where whatever the alcoholic foods or the abusive foods, you sustain, you don't have them. There's rigorous honesty around all thoughts or feelings. And then there is some type of disciplined spiritual program like the 12 steps, but there are also a lot of other spiritual programs, whatever that that is to get that part. And then certainly the emotional and the physical, the same, similar to what the normal eaters do. And so it's a combination of that really, works for food addiction. And so, the interesting thing here is the symptoms of addiction. And so a lot of times, and this, I'm going to give you a lot of examples of this from my own life, is that we don't realize that addiction is actually at the root of a lot of our symptoms. So, the reason that somebody comes into treatment for addiction is because they're suffering from some type of symptom and they need relief, they want relief. And so, for me, for physical symptoms, right? Like you saw my pictures, I was obese, I was miserable. I developed diabetes. I worked in a diabetes clinic and yet I had diabetes, right? Because I could not stop eating. I had chronic pain from being overweight. I had knee surgeries and, just, lots of arthritis, for my age. And, I had tons of dental issues from being bulimic for so many years. I had, greater than 15 root canals. I've had implants of my teeth. I've had bone grafts, just significant dental issues. I had irritable bowel syndrome because I was gluten and, intolerant and dairy intolerant. And yet when I was binging and purging, I couldn't not eat those. And so I constantly had stomach issues because of the, eating foods that I couldn't tolerate. From the obesity, I had untreated sleep apnea. I also, with all the esophageal purging, I had so much reflux. I actually tore my esophagus from purging so hard. I developed multiple autoimmune diseases like lupus, which led to multiple miscarriages, chronic pain, inflammation. And then really at the end of the disease, when it was at the most severe, I would drink huge amounts of fluids to help me when I was going to purge. So when I binged, I'd drink a huge amount of fluid and then, I'd get really tired because I'd gone through a binge purge cycle and it's exhausting. And so after drinking a huge amount of fluid, I'd fall asleep. And because of the damage to my esophagus, the stuff from my stomach would aspirate up into my lungs and I would wake up choking. And in the 4 months prior to me seeking the final treatment that I did, I got chemical pneumonitis, and it, a burn in my lungs from aspirating on this, and was quite sick. And the last time it happened, I didn't even go to the hospital. I was like, I am done. I can't, it doesn't even matter. It's not, nothing's working. And, I never saw myself as a quitter or someone that was suicidal, but I just was hopeless, which I've learned to mean is I was out of ideas. I obviously had anxiety, that with all these health issues, but I feel like I had chronic anxiety my whole life. I felt like I was an anxious child. I just didn't recognize it. And food was my anti-anxiety medication. It was comforting. It calmed me down. And then, it's very common to have other addictions. I had a shopping addiction. And I think that especially when with constant changes in my weight over the years, at one point I had the same pair of Ann Taylor black work pants in a size 2 through a size 14. So, I did that. I also, had, thankfully in my work, I was able to support myself financially, but I wasted so much money on food. At the end, when it was really bad, I was spending like $1,000 to $2,000 a month on food. That's like up to $24,000 a year. Like it's an insane amount of food, not to mention what I spent on shopping. Other consequences is that to offset how horrible I felt about myself, I was a workaholic. I worked about 70 hours a week. I was exhausted. And, all of these things, caused some strained relationships with family. I really had trouble having, I was married for a while, for 5 years. And, but I really had trouble having an intimate relationship because food really became my primary comfort and my abuser, right? Like I had this sick and twisted relationship with food. And so it really impacted other relationships. And then I think the spiritual is the hardest one of all. I couldn't look at myself in the mirror. I was just so disconnected from myself. I hated myself. For years, I just would say I was ahead. I wasn't even connected to my body. I only looked at mirrors where I looked at my head up. I didn't look at, below my neck, even when I was thin. I just felt so disconnected from myself. And so these are the reasons that we seek treatment, right? We either seek it because most of the time for food addiction, we seek it because of our weight. We're miserable, we can't stop eating, we gain weight. And so being a provider, when I would see somebody in the office for whether it was alcohol or drugs or even food addiction, they're coming in complaining of anxiety or depression, or they're coming in to talk about their diabetes, and I'm treating those things, right? I'm treating those. I'm not saying, hold on, wait a minute, let's look at the root of this. The reason that you have all these other things is because you actually have a food addiction, or addiction is at the core of this. Nobody said that to me, and I didn't know it, and I wasn't saying it to other people. But so over the years, people did treat some of my symptoms. So I had periods where I felt better, right? When I was on certain medications, I felt a little bit better, and I was less motivated to get treatment because I felt better. But it didn't last. It wasn't a lasting treatment. It didn't solve the problem. And so, we're in this really unique and interesting time for food addiction right now, is that, so the DSM-5 is the American Psychiatric Association's, manual that they used for diagnosing any mental psychiatric problem. And so these are the criteria that I have listed here on what qualifies as a substance use disorder. Currently, food is not acknowledged by the DSM as a substance use disorder. This could be a whole other talk, and there's lots of great information about it. But the food addiction community is really working hard to get this acknowledged, because once it's acknowledged, then insurance companies will pay for treatment. But right now, we use diagnoses like binge eating disorder or eating disorder other. But really, when you start going through these things, the criteria, it really makes sense. So, look, if I'm using myself as an example, did I use more food than intended or use longer than I meant to? Absolutely. I meant to just have one serving or one bite, right? And I just kept having more, to trying to cut down or stop using the substances, but we're unable, right? That's another symptom or a sign that somebody has a substance use. Yes, absolutely. I tried to cut down numerous times. You saw the slide with all the things that I tried. Did you experience intense cravings or urges to use the substance? Absolutely. I woke up in the morning, I was absolutely not going to do it again, right? This was my last day. Today is the first day of the diet. I'm never going to do it again. And then, sometimes within 10 minutes, right, I have it in my mouth already. And it was like, what is going on? And then needing more and more of the substance to get desired effect, right? When I was younger, I could just eat a smaller amount and I was thinner, but it just wasn't enough. And I had to eat more and more and more to get the exact same, experience as I did before. And that's called tolerance. And then, having withdrawal symptoms, they may not be as drastic as withdrawing from drugs or alcohol, but absolutely, if I don't have, if I didn't have sugar for 24 hours or 48 hours, I did not feel good. And I was cranky and I had a headache and, I was irritable and, there was a lot of physical symptoms that happened. Spending more and more time getting and using your drugs or substance and then recovering from them. Absolutely. Absolutely. A lot of my, spare time was spent, getting food, finding food, thinking about food, and then also recovering from a huge binge or purge, right? Like I didn't feel well. I called out of work. I missed some work. I missed social events because I would rather eat, or I just didn't feel well from eating before, or I had a binge early in the day and I meant to go to the thing, but I just couldn't. I couldn't do it. Neglecting responsibilities at home or work or school. Absolutely. Continuing to use even when it causes relationship problems. Absolutely. Right. Like there was nothing that was motivating me. Giving up desired or important social, recreational, using substances in risky settings that put yourself in danger. I mean, choking to death, right? Like that's a danger, right? Like it was such a miserable experience. And that was like, we'll talk a little bit in a couple slides about singing the national anthem when it's like, I'm absolutely done. And that was true for me after I, was sick with the chemical pneumonitis. I am never doing that again. I am done. This is rock bottom. And yet, a minute, a day, a week, it happens again, right? I'm back in the food and I did not understand what was wrong with me. And so continuing to use these. So, if we go through the list of substance use disorder criteria, you can see how what I was suffering with met that criteria, right? Like it really met that criteria for that. So Shift uses this really brilliant way to describe, food addiction through the disease concept of addiction, which is, true for any addiction. This is, this will, and, this is recorded, right? So you guys will get to see it again if you want to, if you don't catch everything, because there's a lot that's going to happen on this slide. But I think the first part that's really important to note is that there's two components of addiction. So many people that are in some type of addiction treatment say it didn't work for them because only one of the two parts got treated. So there's a physical component and there's a mental component, and you have to have treatment for both or it does not work. And that was absolutely my case. So, so the first one with the physical component, it starts when we ingest a substance that triggers an addictive reaction, right? So for a lot of food addicts, it's sugar, flour, high fat, highly processed food will trigger a reaction in them, the same as alcohol or drugs would do for somebody else. And so I think it's good to pause for a second, clarify, like, what is a normal reaction, right? So a normal reaction for somebody that doesn't have this addiction would be to eat a couple pieces of candy or two cookies, right? And then they don't want any more. Like that's mind blowing to me, right? Like it's like, no, two was enough. I don't want any more. But that's a normal reaction. Somebody they start to feel sick. It's too sweet. They don't want any more. That's a normal reaction. And so, if we look up in the dictionary, what is an allergy? It's an abnormal reaction to a food or substance. So if 1 out of 10 people, or 9 out of 10 people are responding normally, like they eat a couple and they don't want any more, then those that are having an abnormal reaction are having that allergy. They're having an allergy. They're responding with me. When I eat one, I have to eat the whole bag. I can't eat just 2 or 3. So that's abnormal, right? That's not a normal reaction. That's not how the majority of people respond. So when I eat certain foods or substances, I have an abnormal reaction. And this is actually, what we'll talk about a little bit more on the next slide, is that this is actually a brain disease. There's something happening in my brain that is causing this reaction. It's not something I have any control over. And so, what we become obsessed with as, people that have struggled with this is that there are times that there's like, Mercury's in retrograde, everything lines up. I can eat 2 cookies for one moment in time, right? And I remember that day and I'm like, well, I do have a problem with, say, chocolate covered popcorn, but there was that one day that I ate just a handful and it was fine. And the analogy we use is like Russian roulette. And so Russian roulette is the game they used to play where, the gun that could have, up to 7 bullets, say they put 1 bullet in. And so they would play a game that sometimes when they would squeeze the trigger, they would just get a click, right? Like nobody would get hurt, the bullet wouldn't come out. And other times when they'd squeeze the trigger, a bang, right? A bullet would come out. And so we're always looking for that. We're hoping to have a click day where I eat and I don't get the shot. And what we know about addiction, it's progressive. massive. And so there's more bullets, right? By the time I'm in end stage, there's 6 bullets in there and only one click day. And you never know when it's going to come, but we are obsessed, or I've been obsessed, and most addicts are, of having a click day. But so you ingest the substance, that's the first piece, and you have the abnormal reaction, right? So that goes off in your bang. And what does it do? It creates physical cravings where everybody else, they want to stop eating after a couple, but the addict gets that physical cravings and they start eating more and more and more. And that leads to a binge, right? And then if you've ever had a binge, you know how horrible you feel afterwards, physically, emotionally, spiritually, just feel awful. And that's when we sing what we call the national anthem, right? I am done. I am not doing this anymore. I can see I can't even eat a cookie, right? I can't. So that's when we go, I'm going to go back on a diet, or I'm going to try the new food plan, or I'm going to do whatever the next thing. I'm not going to do this anymore. And then that takes us over into the mental part of this disease, because all the while that this is happening, this whole reaction, life is happening to us, right? Like life is going around us. So there's normal experiences, life happens. I have a day, I feel happy, I feel irritated, I feel angry, I feel sad, all these normal things that when we're living life, this is just what happens. And we have what's called emotional barometer, right? Everybody has it. And, as we live life, this starts to fill up. And what I used to think was that food was my problem. And what I learned in treatment is that food was the solution I used to solve my problem. And the problem was actually this buildup of normal human emotions. I did not know, because I started using food to help with my emotions so long ago, I really didn't develop other skills to do that. And I used food to, when things are going well, oh, let's celebrate. I'm going to have a cupcake. I deserve it. I had a hard day, right? Or if, things were really like, oh, they were so, I can't believe they did that at work, that really hurt my feelings. I'm going to have a food, I'm going to eat food to make myself feel better. And, what really happens is, especially in the beginning, it does, right? When I eat the thing, whatever the thing is, for about 8 seconds, I feel fantastic. And then, what we'll talk about in the next slide, the dopamine drops and I need more. I need more to get the same effect. And so but at this point, we've sung the national anthem. We've said we're not having any more. And so then we're living life and our emotional barometer gets really full. And in the beginning, we can do okay with willpower, but once it hits the boiling point, then as an addict, I have absolutely no choice but to pick up the food again. I have no defense to keep me from picking up that bite. And it usually is like, it'll seem like out of the blue, I was doing fine. I wasn't even thinking about food. I might have been a little annoyed about something. And then all of a sudden the thought pops into my head, I'll just have a cookie. And I forget all the consequences of what actually having a cookie means, right? There's something in my brain that makes that not as important as the thought is a cookie is what I need to feel better, and I can eat just one. I really believe that. And so then I go ahead and I eat the cookie, and then I am back in the physical side again, right? Because then I start having the cravings after eating the cookie. And then, that takes me to a binge. And we call this the roundabout, where we just keep going around and around and around, and we cannot get out. That is what happened to me. And then, I think another good piece to just say is that at this point in addiction, when we get to this part, we are absolutely powerless. We're powerless to get out of this cycle on our own. We can't, no matter what we do, we're powerless. We need external help to get us out of this cycle. And then just going over the little bit, touching on the science of food addiction. And so there really is, this could be its whole sort of lecture on its own, but the overview is there's really two main things that are happening with food addiction. And so first is the hormonal pathway, which is on the right hand side. And so for everybody, whether they have an addiction or not, we eat, when we eat, it's for pleasure, right? And also for hunger. And we rely on these cues for our appetite, that when I'm hungry, I eat, and when I'm full, I stop. And so, they're actually, this is, the the science of hunger and eating is a huge area in science right now. They've identified at least 18 hormones that are involved in this hunger and fullness, but the three that we're going to just touch briefly on today that are mainly for food addiction. So ghrelin is a hunger hormone. So it's a hormone that is released that tells me when I'm hungry. It's subtle. It's like a little bell ringing, right? Like, you're starting to get hungry. It's activated when my stomach's been empty for, 4 or 5 hours. And there is a connection with ghrelin and dopamine. So dopamine, we're going to talk about next. That's the excitement chemical in the brain. And then, sort of the opposite of ghrelin is the leptin. And so that's the satiety or the full hormone that when I'm eating, it tells me, okay, you're getting full, slow down, you're having enough. That usually it's subtle. It usually takes about 20 minutes of eating before the leptin kicks in. And so, that is okay when we're eating a nice balanced meal, right? Like, because it takes a while to chew whole foods and eat. So, about 20 minutes, we start getting that full feeling and not want to eat, versus processed foods or things of sugar or fat or things that are just really limited in nutrition. You can eat those really fast, and so you can get a lot in 20 minutes, right? And you start blowing through these hormones, and so we miss that. And then the third one is insulin. And so insulin is a really important hormone in the body. It regulates sugar. It's also a hunger hormone, but it works differently. And so, there's been a lot of damage to food addicts if they've been eating a lot of sugar and carbohydrates for over a period of time. Even if somebody hasn't developed diabetes, that there is insulin resistance. And, when there's insulin resistance, our body's requiring more and more and more insulin to do the same job. And then when that happens, then the glucose can crash. So we're getting these spikes in our glucose up and down and up and down. And when the glucose crashes, that's the body sends out an urgent hunger signal. This is not the subtle hunger signal that we get with ghrelin. This is a really intense, I can't ignore this. Like if it's getting a little bit close to my dinner time, I'm feeling a little bit hungry, but because I'm engaged talking to you guys, I'm not really paying attention, and I'm not, it's quiet. I just hear it in the back. But if this was a crash glucose, like I would have physical symptoms. I would, feel shaky. I would be irritable. I couldn't ignore it. I'd either have to pop a piece of candy or take some juice or do something because it's in my face yelling at me. And so, those hormones are skewed already when we've been eating highly processed foods, or, we've been eating, a lot of glucose rich foods, or, carbohydrate foods for a long time. And so we throw off that normal mechanism for hunger and fullness. And then the other part is, the dopamine. So there's actually, similar to the food, there's multiple hormones or neurotransmitters involved in this reward system of our brain, serotonin, endorphins, but we're only going to talk a little bit about dopamine as the main one that's in addiction, any addiction. And how do we know and again, with the skewing of our insulin, right? That insulin, over release of insulin increases our dopamine. And, the confusion with the ghrelin hormone increases our dopamine. So as a food addict, we have excessive, sort of leaking of dopamine already. And then symptoms of excessive dopamine are feeling strong feelings of desire, craving, or obsession with certain foods, right? Can't stop thinking about food. Oh, wanting, what's my next bite? I have to have more, like that urgent sense that's coming from the dopamine. And then what happens when we've had this extra dopamine for so long that our the receptors downregulate, meaning I need more of the same, right? Like I need more to reach the same effect. That same thing we talked about is like, I felt fantastic, for that first eight seconds that I ate it, and then it took more and more. So it might have been, I have cookies several times a week, and then I have cookies every night, and then it's I'm not eating my dinner, I need more cookies, I want cookies instead, right? So it's more and more and more. And the interesting part of that with the dopamine over a period of time is that, where we originally do it because we like the effect, it gave us a high, some type of high to do this, and that over the time, because of the downregulation of dopamine, we don't ever even get to the high anymore. We just need more and more and more just to feel normal, just to feel like everybody else feels, just going throughout the day, right? It's not even to get the high anymore, but we're searching, we're seeking, we're trying to get that high. But you can see why this is progressive, because, if I just need that just to feel normal, and it's going to take more and more and more just to feel normal over time, of course it's going to get worse and not better if it's not treated. Of course it is. And so learning this in treatment was life changing for me. And, I realized I'm not crazy, I'm sick. And I have a disease. And, I think the key is that I really thought I was the disease versus I have the disease. And so really being able, a year and a half out, being separated from it and really being able to see that and know that and experience it, it's been so profound to me. The other thing we had just talked about, right? Like that addiction, untreated addiction is always going to get worse. It's chronic, it's progressive, right? It's just, and what looking worse could look like, right? Look at the arrows, like, okay, it's getting bad. I do an intervention, somebody treats my anxiety, or I go on a diet and I feel better. And that worked for a while. And then all of a sudden it doesn't work anymore, right? And so we can see there's peaks and valleys, like there's some improvement, but the overall slope is down, right? And, there are some too that we don't know how long we're going to get. We don't know if we're going to get some ups and downs. And look at me, like I could have, aspirated and died at 48, right? Because it was progressing rapidly. And, we also, with obesity, with all the statistics, it's a huge epidemic for our country and the world, right? There's more people that are overweight than undernourished, and that in the world, and that is a huge change. 2.8 million people are dying, each year from obesity or overweight related disease, lifestyle diseases. And, it's not something that's on death certificates at this point. It's more of somebody died of heart failure or heart attack or, diabetes related stuff. So it's stuff that I think the numbers are even way higher. And so, so one of the ways, the question is, how do I know for sure if I'm a food addict? And so this is a Yale food addiction scale that was created, I don't know, about 15 years back by one of the food addiction researchers, that has the screening based on those 11 criteria that I had showed you about what qualifies as a substance use disorder. And they made this, this validated tool that can be used to screen. And so Tosca has put links in our chat, but we have a link to a free Yale food addiction scale that you can do, that you'll take it, and then you'll get an email from us at Shift telling you your score and recommendations based on that score. And so I would highly encourage you, if you think you might be a food addict, do the Yale food addiction score. And so then, what people are certainly want to know is like, okay, I think I'm a food addict. Now what, right? Like, what do I do? And, there's different stages, just like any disease: early, middle, late, and final. And the treatment, varies depending on where you are. And, people will get really caught up on what stage am I in? And, for the disease, it's not even that it matters. Is the treatment working for you? Is your life better? Are you not struggling in the food? And if it is, then what you're doing is helpful. And if you're not, then you need to up the game, right? You need to step up the level of treatment that you needed. So for me, by the time, if I had gone to treatment 15 years ago or gotten, the right diagnosis, then, maybe I would have just been in earlier middle stage, and I had to have a awareness of sugar and flour, monitor that intake, and just understand myself. But by the time I came in final stage, I had to go to, Shift offers an intensive, program where you're there for 8 days, and then they have a 10-week aftercare. And I needed that. I needed lots of professional support. I needed to be, Shift for their spiritual treatment. They use a 12-step program. And that, I needed all those things to support me, because I had spent 30 years, my main coping mechanism for my solution to every problem was eating and food. And so I needed a new way. And so, with these different stages, there's different levels of support that you can get. And certainly Shift has that for anybody that's interested in that. But, the key is, if you have a food addiction, why just moderation is not going to work. So if somebody is diagnosed as an alcoholic, they're not saying, okay, you can have 3 tiny glasses of alcohol each day, right? Like that would not be, if somebody was diagnosed as an alcoholic, that would not be a treatment that anyone thought was a good idea. And yet, constantly it's, why can't you just have one? Just have one, just one bite. And I even heard that from the medical community. Like, we want you to be able to eat every food in moderation. Yeah, me too. But that's never been my story. I can't do it. And so I can't eat, any food that has sugar or flour in it. I can't. I would love to, but I can't, because it ends, you saw where I ended up, right? That's where I end up. That's where it takes me. And so I think that's a really different piece of like eating disorder messages, is that sometimes it really is the food, right? And, if you're chemically dependent to the substance, then you can't safely take it and be okay. And that has to be part of your treatment program. So, just to kind of full circle here, the diagnosis, I was diagnosed as a food addict with bulimia. I went through the Shift program where they did, the abstinence, which was my physical recovery, the professional support. I had I did the inpatient and then the aftercare, and then I had a, professional therapist that I met with weekly that specialized in food addiction. I do a 12-step program myself to have that community. And then I have a community of other people that understand what I'm going through and can provide support, because that's so key. And then you can see this is me. This is me actually while I was in treatment. Not a happy camper. It was not fun at all. And then me now, right? So 75 pounds down, which is such a small amount, like Tosca said. But after 30 years of binging and purging, I have not binged or purged in almost 18 months. I have complete neutrality around food, meaning I can be in a room when people are eating whatever they're eating and I don't crave it. I'm not fighting the food. I'm not white knuckling it, as they say in 12-step programs. And I have, been returned to sanity, right? Like all the insane things that I did with food and around that. And that's a lifelong thing, right? Like, so all those consequences, like that takes a lot of time to kind of, to learn new ways to live in the world. And that's what the emotional sobriety is. So, just, so excited that you guys were here. We are going to open up for questions, but Shift is here. We certainly can help if somebody's interested in, we offer free 30-minute consults. It would be done by myself, Tosca or Tina, one of the coaches. We have free Shift Strong meetings. They're 4 times a week. It's other people that struggle with food addiction, such a supportive community. Tosca's putting the links in the chat for that. The Yale Food Addiction Scale, we are primary intensive. That's that treatment that I had done. That is the bread and butter, sorry, the food analogy, but of Shift, of their main program. But then there's also, for maybe mild people that, that don't need that extreme, there's an online food freedom program. We have coaching, we have counseling, meditation things, but you don't have to suffer you don't have to suffer. You can, there is hope. And yeah, I'm gonna pause and thank you and would love to hear any questions. I know we're right sort of at the button on time, but I know Tosca and I would be happy to stay for questions.
Yeah, thank you, Christine. That's such a beautiful, powerful story. And I just feel so grateful to have been able to play a part in it, really, because I took your first consult and I was there when you came. And I was kind of wondering if you would share, because listening to your story, um, just because I know denial plays such a part in our survival when we're in the disease. And just thinking back to you when you showed up at that intensive, can you talk a little bit about like just what it took for you to get desperate enough to come, and what it took for you to take the steps that have kept you sober this last year and a half?
Absolutely. Thank you for asking that. Yes, absolutely. I think the desperate was one, I was at the highest weight and just kept gaining. I couldn't stop. And then the second one was certainly the aspiration and, the medical consequences. But even when I went to treatment, like I just wanted help with my weight and to fix the eating thing. Like I thought the rest of my life was okay. And it really, and looking back of it, or if you put this whole thing together, that just seems ridiculous, right? Like there was so many issues, but I really was so disconnected from that I just really thought like, I was asked to stay longer at the treatment, that I was asked to stay longer than the 8 days. And I was very resistant to that because I was going to miss, a family, several important family events that I really didn't want to miss. And then I was strongly encouraged to take a leave of absence from work during the aftercare. And as a workaholic, I was adamantly opposed to doing that. And so, it took the shift team to really, sort of, stand up and hold a mirror to me to say, you are dying. You are dying. You are so ill. And just because you're high functioning in one area that's overcompensating, you are really sick. And it was the greatest gift. It was actually such a relief because I knew like something was wrong. I kept trying so many things, and it was a relief to have somebody, be able to hold space and be honest and say, just it doesn't matter how well you're succeeding in your career or anything like that. You're very ill. And I think that is a really hard piece, to admit that, because it's not like I'm homeless on the street or, where I'm constantly getting arrested, like the way the consequences might be for a drug addict or an alcoholic, where, I'm falling down in public or humiliating myself or, those kind of things. So it seems like a softer addiction that, it's harder sometimes to even want to use the word addiction, right? Like it's more of like a gentler word like compulsion or something. But like that was not, that wasn't the truth. And, I think, I'd hope that other people don't have to get as far down the scale as I was.
Yeah, yeah. Thanks for sharing that. And I think, I guess it's just like I think people are down that scale, and just to know, like we often can't fix this ourselves. We don't know how sick we are, and we really need to reach out to help. So I see we have a hand raised here. Susan, do you want to ask your question?
Yes. Hi, Tosca. Hi, Christine. Thanks for this. This has been great. Question is, I'd love you to talk about food addiction as a chemical dependency as you have, as compared to food addiction in behaviors. And
Mhm.
how much does the chemical addiction lead to the addictive behaviors? And how much of the addictive behaviors are more psychological?
Mm.
Um, so there's food addiction chemical and there's food addiction addictive behaviors. Does one lead to another, or is one more psychological?
Yeah, I think it's a great question, and it, it brings me to the visual of the roundabout, right? Where, there is a piece. And so I think that, a chemical dependency, once a chemical dependency is formed, that is influencing the behavior that we do. Certainly, when I started, bulimia, right? When I started purging years back, I think I had a sensitivity towards sugar, but I wasn't chemically dependent then, right? I had the behavior of the bulimia, and then once I became addicted, the behavior really kept me in the loop. So, I think you can also, there are process addictions that are behavior addictions. So something like gambling, right? And so we can have people that are obsessed, like have an addiction to the behavior around a certain eating, versus, it's a behavior ritual that we've kind of developed as a comfort. Or a lot of times there is rituals around the eating. So for me it was a certain food, certain foods in a certain place. And I know other addicts that they were always binging when they're driving, right? Like they were going to get the food and they'd have to eat it in the car, and it was really urgent and in the car. And that was not for me. For me it was like, I have to pick it up, but I have to wait until I get home. And it's like this, ritual of where I'm sitting and what I'm watching and, what's going on. And so, that behavior, I think that is more of, a coping emotional, piece to it. But I definitely think they go hand in hand. But I think the chemical dependency, if somebody has the chemical dependency piece, but if it's, just the behavior piece, then that's become a huge coping mechanism. And so for me, I thought I was addicted to purging, to being bulimic, but it turns out, I'm a food addict. But that was a compensatory mechanism that I learned as a way to not lose weight. But I also it became a normal behavior for me, but I wasn't actually addicted to it. And so when, where some people are, but when I stopped binging, and I'm on a weighed and measured meal plan, that that desire to overeat isn't there. And so I don't have a desire to throw up if I eat the right amount. If I eat one bite too much, then that desire would be there. But that was a compensatory behavior.
Oh, good question, Susan. We had another question a while ago when you were talking about BMI. This was from Debbie. She asked, if BMI is not the current parameter used for weight, what is the current mode of discerning weight goals that are within the most current research?
Yeah, absolutely. So it's a great question. And so, I hesitate on even talking about focus on how to measure, the weight right now, because I feel like
Symptom. It's just a
it's a
symptom.
symptom, right? It's a symptom. So, it's more of a formula of your height and your waist circumference and, your age. And so there's other components that are put into, how they're looking at it I think that's going to change, especially in 2025, that we're really going to be getting rid of that data point. But it is a symptom, right? So I hesitated to even put BMI stuff in there, but I think it was more of seeing like the change of the way that my disease manifested over time at different weights. But it really is a symptom. But it has to do with more with weight circumference, and other waist circumference and other pieces of information.
Yeah, okay. I wanted to say, Susan let me know that she was not able to copy the links that I posted. So if anyone's having trouble, you did register, you will receive an email with the link to this replay, and all the links will be available there as well. So no worries if your computer is not working. Although I do have to say, it's just as easy as going to foodaddiction.com. And the very front page of foodaddiction.com has links to the consult and the intensive information. And if you click up on the top, you can find the Yale food addiction scale. So everything can be found on foodaddiction.com. So that's very easy. Are there any other questions out there? We've got some time still, and we do want to answer any questions that anyone has. This can be, such a challenge and such a struggle, and like you feel all alone, and you're not. You're just not.
I, I, my name is Diana Escobar. I'm not good with my phone. I always go on Zoom with my laptop, but it broke, so I couldn't get on it. So can I ask a question?
Sure, go ahead.
I first want to thank you very, very much because I'm very knowledgeable in 12-step program. And you ladies did a wonderful job. And you said exactly what it is. And I knew that. And somebody guided me to your to Shift and told me it's a wonderful program and they really believe in it. The thing is, I work for myself and I don't have a lot of insurance. I'd love to come down there for a week, right? Do you do the kissing me thing for about a week? I would love to do that. I mean, I've had abstinence for like 10 years and it has been, weighed and measured and all of that. Well, I got off of it and I don't know what the heck is going on. And before I gain a lot of weight, even though it's not the weight, it's the thinking. That's all I think about is the food. So it's very difficult. I'm sober and abstinent from drinking and drugs for 38 years. So I know a lot. But I can't seem to get my hand around this. And I have had it. So what I'm asking you, are there scholarships? What kind of monies are we talking about? I would love to come down to you guys for a week or even like a weekend. I saw you had like a 3-day thing.
Yeah. So
could you touch on that? Because I'm really interested.
Right. I would have to say that that we do not take insurance and there's very limited scholarship funds. However, we do payment plans, and we, obviously we know that people don't always have a bunch of money in their back pocket. And so we make it possible for people to come. I would say call the office. You can find the office phone number on foodaddiction.com. And Renee at the office, she's great at finding ways to work around. And we also say, I totally get you. Like you had it, you lost it, you need to getting it back. And we're here for you. That is what we're here for. And honestly, I know that there is a cost associated, but there's such a cost associated with not getting into recovery that like a payment plan is almost equal to the food budget that we spend on average. I mean, it's not very much different. So.
And so are there also like free things that we could do that you guys do for us if I can't get down there or like
I would recommend that you get do a 30-minute consultation. It is free, and then we can really walk through all the things with you one-on-one and just tell you what we have. We do have the Shift Strong meetings that are 4 times a week, and they are just a beautiful resource. Our community, our alumni community, is just so loving and supportive, and you are welcome to jump right in with us.
Oh, great. So call the office and
go to foodaddiction.com and just click on that 30-minute consult.
And then I'll get more information.
Yeah.
Okay, thank you so much. You guys were very wonderful. Thank you.
So glad you're here. We had a couple of other questions roll in, and we have Rachel with her hand raised. Rachel, do you want to go ahead?
Hi, I'm Rachel. I'm a recovering food addict, and I just wanted to thank you, Christine, so much for your share. I really identified, and I just wanted to voice my frustration with. Still seems to me like the mode of treatment for eating disorders is sending people to be normal eaters, and I spent years, before I ended up finally in milestones in recovery 21 years ago. But I just, I was going to workshops to become an intuitive eater, and I just, my weight just kept going up and up and up. And I'm actually just about to start doing some work with possibly on the board of the Food Addiction Institute, but I just wanted to know, like, you know, I get sponsees and I want to send them to nutritionists, and it just seems that there still are such a minority that understand a food addiction nutrition food plan. So anyway, I guess my question is just, you know, mainly, am I in the dark? Are there actually more understanding now out there than there was 21 years ago when I went to Milestones?
Yeah, it's such a good question. Thank you for sharing that and your story. And yeah, it's an evolving science. So, Tosca was part of there was the first international conference for food addiction in London this spring. And, professionals from all over the world met and are trying to unite first in what is the definition of food addiction to try to get it accepted by the World Health Organization so it can go in the DSM. And right now, what we're leaning is highly processed food addiction is the definition. But I think that is a big piece of it, is getting it acknowledged in the DSM. And there certainly are more pockets around, I think, than 21 years ago. And that's great if you're connected to that organization for Food Addiction Institute. But it is challenging. And so that's why I think that those of us that are in the recovery and in the, treating addiction, really to stick together and share resources for sure.
Yeah, I'm super grateful that the Food Addiction Institute is out there. And, my experience with the International Food Addiction Consensus Conference was, it's incredible to see people really trying to pull together. And there's still a lot of confusion out there between moderation and abstinence, and even there. And you're so right. There is a huge lack of sound nutritional information that can come from a food addiction construct, knowing that we have to treat food addiction more than that nutrition has to fall below addiction. We have to treat our addiction as a primary. So thank you for bringing that up. And, we're just hoping that as we continue to forge forward, that we see more and more people that really gain a good understanding of what food addiction recovery looks like. So thank you for that. But let me read one question from the chat here from Kate. Do you consider yourself as having had an eating disorder with the trauma piece, but having an underlying food addiction?
Yeah, I think it's a great question. Absolutely. I suspect, it started as an eating disorder, and probably from, what we discussed. And because of my likely chemical dependency to sugar, which started really young, those, snowballed into a food addiction, and the bulimia as a compensatory mechanism continued. But yeah, I think there's a lot of overlap with eating disorder and food addiction. And so I think that that's another area. And I think, Marty Lerner at Milestones does a great job on really looking at eating disorders from the food addiction lens. And so I think there really is a lot that we don't know, and that we're just finding out about underlying addiction with eating disorder. But, I think the key is, if you're doing the treatment and it's not working, then to look at to see if there's a chemical dependency. But yeah, I think for me, it started as an eating disorder and then morphed into an addiction.
Yeah, that also reminds me, there was a great podcast with Marty Lerner and Amanda and Esther Helga from the InFact School, the food addiction, the problem and the solution. And there was a great podcast with the three of them. Lots of good experience with that. So I would recommend catching that. And I think that's also listed on our website and our media page. So check that out. We have quite a few other good resources to look at there. I have a message, and Nancy, I'll come to you next. I see your hand, but I have a message here from Melanie saying, honestly, I feel hesitant to do the intensive due to being normal weight. There seems to be such a focus on being overweight. My addiction is sugar. I, like Christine, have had a long history of food issues since a child, trauma, lots of therapy, but my sugar issues still persist. So feeling uncomfortable about coming as if being normal weight makes it not such an issue. And I would have to say I've been to the last 2 years worth of intensives. And Melanie, there are many, many people who show up that are normal weight or underweight at intensives. So you would not be alone. We treat addiction. It is not a body size. So, you know, and you also asked, is Kissimmee unaffected by the hurricane and still up and running for November? And as far as I know, yes, and we do still have a few spots left. So it is available. There's not many spaces left. It is quite small, just so in case people are wondering. We max out around 12 people in a house together for a week. And it's an experience that is beautiful. It's hard work for sure, and it's life altering, and it's precious. It's just so special to be at one of these intensives. So thanks for that question. And then Nancy, can we come to you?
Thank you so much. I apologize for getting on a little bit late because I forgot, but let me see how I can do this question. I've been through all different realms of an eating disorder. I started in 1986, and it's morphed into so many different ways. Gained and lost 70 pounds 3 times, and then I was in the hospital for malnutrition. I've also been bulimic, and the last probably 4 years, it looked like, what did it morph to? It morphed into something I'd never had before, where it was like afraid of buying food, what to eat, what should I eat? And just got really obsessed about that. And then I went through a divorce. The last 4 years were just really traumatic. And I've gotten to a place where I can binge on anything. Like I've binged on everything. I've binged on watermelon. I've binged on cantaloupe. I've binged on, like, potatoes are just like such a trigger food for me. And so like the foods that used to not be a trigger food have become a trigger food, just because when I would binge, like I knew what apps, like I knew what was to stay away from. But then it was like, well, what can I eat that's on the food plan? And so that's kind of like where I'm at right now. And I know that for me, just I have had so many feelings plus trauma has come up for me. It's like my past has collided with my present with this divorce. And I don't know if I'm making any sense, but and I look somewhat normal, but I have been struggling with binge eating, which I hadn't done. The level of binge eating I'm now 60. I was doing like eating like I was 19, like crazy. So I don't even know if that's a question or anything, but
Well, thank you so much for just sharing your story. And you are so not alone. I've heard many, many people with very similar stories. And yeah, I mean, it sounds like you need help. And the roundabout that Christine was showing earlier, it's like you're trapped in this because what the treatment that you need is not just physical. So this is what happens a lot to people is they get this information of like, hey, abstinence, and like here's a food plan. But if we don't treat that emotional barometer, then you absolutely cannot stop yourself from finding some way to use something as a solution, because addiction is a mental health disease, and you're struggling with that. We don't know how to live in the world. It's not really about the food. It's like I just need relief from the misery that I'm in. And so I would suggest that you set up that 30-minute consultation and really take a look at what we have to offer you, because there are some other places, other programs that you might be able to go to, but SHIFT really is like the intensive care for food addiction. And you sound like you have like in stage food addiction. Like this is not where you want to be, and we are here for you. So thanks for being vulnerable and just sharing that. Do you have anything to add, Christine?
Well, I completely agree. And, I think the key is, realizing the problem and, reaching out for help. There's help available. And it's very brave for you to share that with us.
Yeah.
And there's so much hope.
And it's not your fault, Nancy. It's not because you're like a defective, bad person. You just need help. If you had cancer, you'd go get some treatment,
Right. So you do deal, and I know you probably said it, but I probably need to hear it again. You do deal like with like what's underneath it? Because I feel like I have so much stuff underneath it.
Absolutely. That is what we're dealing with. We are not, we serve up abstinent food and teach people how to weigh and measure if they need to, but that's not what we're doing at an intensive. We are absolutely diving deep into what the real problem is, which is that emotional barometer.
Yeah. Thank you so much. I mean, I probably needed to hear that because I've just been suffering like with the emotional pain, and like I had been like pretty good with food, but I picked up like diet sodas. I'd been off of diet sodas and caffeine for like 6 years, and the diet sodas ended up bringing me back into the food, and like a hellacious cycle. So I appreciate you. Thank you so much.
Yeah, thank you for being here. Yeah, just please get that consultation booked and come talk to one of us. We have Susan dropped in the chat, if anybody didn't see it, the actual link to the podcast I was referring to earlier. So take a look at that. And Susan also mentioned, have we thought about putting 12-step recovery programs on our website as links? And she said she works one, and I would say that so do I, and so does Christine. And 12-step programs are anonymous, so we don't go around saying, hi, I'm running this program. But for many, many, many of us, 12-step programs are at the foundation of what we do. And something like a Shift Intensive can help you get up on your feet, and Shift helps you plug into the 12-step fellowships and into the solution that can carry you for the rest of your life. And they are quite beautiful, totally free, all voluntary, addicts helping addicts. It's beautiful, beautiful to be a part of a 12-step fellowship. So we don't have the links on our website though, so I'll have to bring that up. Good idea, Susan. Do we have any other questions? Did someone text me since then? Nope, that's all I got. Is there anyone else with a burning question? We're coming up on 90 minutes here, so maybe it's time to wrap up. It's been a good time, good questions, great, amazing story. I've had a front row seat to Christine's story, and it's quite powerful. Quite transformational when we can get into recovery. It's like, well, cow, wow, I had no idea how lost I was. And wow, I can feel so much different. So any closing words, Christine?
No, I think, just really appreciate that people are here. And, I think it's the greatest gift I gave myself was to go to treatment, to get the proper diagnosis and to get treatment. And, it's no regrets at all.
Right. So that would be a message to anyone who's still here, or if you're watching this recording later. Part of our disease is that self-neglect of like, I'm not, this is too much. I can't do that. It's too expensive, whatever, like that's part of our disease, to put ourselves last. And don't do that. Just book that 30-minute consultation and find out what it would take to actually get yourself the help that you need. So thanks for being here, everybody. And we'll look forward to hearing from some of you guys, I hope. And yes, blessings to all of you. There is hope out there. Thanks, Christine, for sharing. And thanks, everyone, for being here.
Thank you.
All right. Good night, everybody.
Good night.